Are you a nurse wanting to take the OET exam? Then watch this video where I tell you all about OET nursing and where to start. Hello, I'm Jo from Specialist Language Courses. We are OET Premium Preparation Providers, which means you are in the right place to learn about OET. Don't forget to subscribe for more videos like this. Are you ready? Let's go! So the Occupational English Test, or OET, is an English language test available for the following 12 different healthcare professions. The listening and reading papers of your exam are the same papers taken for all 12 professions, but the writing and speaking papers are profession specific, where you will write and speak as a nurse. So what does the exam look like? Let's take a brief look at each of the papers. On test day, you will start with listening. There are 3 parts to the listening paper. A consists of 2 patient-led dialogues and gap-fill exercises. Listening part B is 6 dialogues or monologues, each with 3 option multiple choice questions. And finally, listening part C, you hear 2 long presentations or interviews and have 3 option multiple choice questions. Listening A is 15 minutes long, listening B 10 minutes, and listening C is 15 minutes. For listening part A, the context of the conversation will always be provided, as you can see in this example. You will hear 2 extracts, each with 12 questions, and you have 30 seconds to read the notes before the audio starts. Information will be provided under headings, as well as information already given to help you keep your place and notes for you to complete. In listening part B, you will hear 6 different extracts, a monologue or an interaction, which lasts about 1 minute each. Part B contains 6 multiple choice questions with 3 options. It's 1 question per audio, and each extract will be a different topic and setting. Part C contains 6 questions for each audio, and they're multiple choice questions with 3 options to choose from. After you've completed the listening, you will start the reading paper. Reading A has 4 short texts with matching, gap fill and short answer questions to complete. You have 15 minutes for part A. Reading B contains 6 short texts with 3 option multiple choice questions. And reading part C consists of 2 long texts with 4 option multiple choice questions. And you have 45 minutes to complete parts B and C together. So reading A tests your fast reading skills, and you have 4 different texts, all related to one topic. You will need to complete a matching task, short answer questions, and sentence completion, otherwise known as gap fill. For part B, there are 6 different texts, and each text will have a question and 3 possible answers to choose from. And you mark the answer by colouring the circle with a pencil. Finally, in reading part C, you have 2 longer texts, and each extract will have questions with 4 possible answers to choose from. If you want to know more about what to take with you to the exam, watch our video Tips for Test Day, link below. So that's the listening and reading. Now let's take a look at the writing paper. So you'll be given a set of case notes about a patient, and you'll have 5 minutes to read these notes. You cannot write during this time. Once the 5 minutes are up, you then have 40 minutes writing time, and you have to write a 180 to 200 word letter. You will either be asked to write a referral, discharge, or a transfer letter. For referral letters, you may need to write to a community nurse, a physiotherapist, a GP, or an occupational therapist. For discharge letters, this could be to a retirement home or a GP. And a transfer letter may ask you to write to a community nurse or hospital nurse, perhaps in another town or city. These are some typical examples of who you might write to. Finally, you take the speaking paper. You begin with the warm-up section, which is not assessed. You will then be given a role play card and you have some preparation time, so you read through the role play card, take some notes and get ready to speak. The role play will always be a consultation with a patient or carer and it lasts 5 minutes. Once you finish the role play, you will then be given your second card and repeat the process again. Here is an example of a role play card from the OET website. You can see that you always play the role of the nurse, the setting is provided, and you're also giving some information about the patient, followed by the tasks you need to complete. So what can you do to start preparing for the OET exam? If you're new to OET, we know it can be a bit overwhelming, so here are a few things that you can do to begin your preparation. First, get to know the format of the exam so you know and understand exactly what you have to do. Then, get to know the different exam strategies for each separate part of the exam. It's important to recognise your strengths so you can maintain these and also help you identify your weaker language areas, which you should work on consistently to improve. When preparing for your exam, practice your skills, focus on improving them, and always make sure you use official OET materials and a variety of reliable resources. If you want more ideas on studying for OET, watch our video on OET preparation, links below. And to help you prepare for your OET exam more, why don't you take a look at our videos, which are packed full of useful tips, exam strategies, and top tips for passing your OET exam. And why not check out Reach OET, our exam preparation course specifically designed for nurses. As well as exam practice exercises and mock tests, these contain pages of materials to help you develop your skills and language for all 4 papers. Link below. Where are you planning to work once you pass the OET exam? Leave your comments below. And if you like this video, please let others know by liking and sharing so we can help more nurses pass the OET exam. See you in the next video. Bye! Are you a nurse wanting to take the OET exam? Then watch Are you ready? Let's go! Subscribe. We are OET preparation providers, which means you are in the right place to learn everything, about life, love. So what can you do to start